Hello, and welcome to Essential Access Health session on prescribing expedited partner therapy. Offering EPT by prescription is an evidence-based harm reduction strategy that helps ensure access to STI treatment for patients' sex partners who are facing barriers to care. After completing this course, you will be able to identify 2 key details to include in EPT prescriptions, describe the process California healthcare providers can use to prescribe EPT using electronic prescriptions, utilize tools to create EPT documentation and prescriptions that meet California law and best practices. Please note this presentation is intended for those familiar with chlamydia and gonorrhea, STI partner treatment, and expedited partner therapy. If these topics are new to you, please consider viewing the Essential Access Health EPT webinar, which can be found on our website. The website is orders.essentialaccess.org/webinar. First, we will provide background information on the practice of prescribing EPT. The CDC defines expedited partner therapy as the practice of treating sex partners of persons with sexually transmitted infections without an intervening medical evaluation or professional prevention counseling. The CDC recommends the use of EPT by stating that expedited partner therapy should be available to clinicians as an option for partner management. The CDC also acknowledges that healthcare programs differ. Therefore, when and how EPT is implemented will vary from site to site. It's important to regard EPT as one possible option for partner management and recognize that it may not be appropriate for all patients or partners. EPT is a well-established practice in California, but reimbursement for partner treatment is a relatively recent covered benefit. Providing partner treatment for chlamydia was recognized as an allowable practice in the California State Health and Safety Code in 2001. In 2005, Essential Access Health began our EPT distribution program for the state of California. We have expanded access for partner treatment by providing pre-packaged medication and technical assistance to eligible health centers. In 2007, the California Health and Safety Code was expanded to allow EPT to be provided for gonorrhea and other STIs. In 2020, EPT became a covered benefit for Family PACT and Medi-Cal recipients for up to 5 partners. SB 306 was signed into law in 2021, which provided explicit liability protections for prescribers and pharmacists. It also authorized pharmacists to dispense EPT without the patient's partner's name, so long as the prescription notes that it is for EPT. As of February 1st, 2020, EPT is a covered benefit for Family PACT and Medi-Cal recipients who test positive for chlamydia, gonorrhea, and trichomoniasis. There are 2 options for providing patients with EPT. The preferred method is giving the partner's treatment directly to the index patient during the visit. Providers can also provide patients with written prescriptions for partner treatment in the name of the index patient to be filled at their local pharmacy. Index patients can receive treatment for up to 5 partners when using Medi-Cal or Family PACT. Patients on other health plans or those paying out of pocket can receive a written prescription for EPT to be filled at a local pharmacy as well. Prescriptions should be written in either the index patient's name, the partner's name, or listing both the index patient and partner's name. On October 4th, 2021, the California governor signed SB 306, known as the STD Coverage and Care Act. This bill allows healthcare providers to send prescription for EPT to pharmacies. Prescribers must include expedited partner therapy, or EPT, on a prescription if the provider does not have the name of the patient's sexual partner. This bill authorizes a pharmacist to dispense an expedited partner therapy prescription and label the drug without an individual's name if the prescription includes the words EPT. This bill specifies that a healthcare provider is not liable in a medical malpractice action or professional disciplinary action, and that a pharmacist is not liable in a civil, criminal, or administrative action if the healthcare provider's use of expedited partner therapy is in compliance with the law. This will help relieve concerns from healthcare providers and pharmacists in expanding the use of EPT for patients who need it. Essential Access has developed visual workflows that outline the steps to treat the index patient, provide partner management counseling, determine if EPT is appropriate, and provide medication for EPT. The workflows also include a sample e-script and current treatment recommendations. In this course, we will cover the steps of the workflow for prescribing EPT after index patient treatment workflow is completed for Medi-Cal, Family PACT, and other EPT prescriptions. You can download this workflow at orders.essentialaccess.org/resources. And contact us if you have any questions about customizing this workflow for your clinic. Now we will cover the process for prescribing EPT. Let's work through the process to prescribe EPT via the sample workflow. Once the patient agrees to use EPT, it is recommended to follow these steps from the workflow. Initiate the prescription. Gather and provide EPT counseling and health education materials for the patient and infected partner or partners. Educational resources in various languages are available at orders.essentialaccess.org/resources. Clinical or health education staff reviews EPT materials with the patient and documents messages in the EHR. EPT counseling and health education are given. Here is an example of EPT documentation integrated into an EHR system. In their plan, they note that they will be providing EPT for 3 different partners and which medication they will be using. Here we can see a sample of how an EPT electronic prescription could be written into an EHR for Medi-Cal and Family PACT patients. This sample prescription includes treatment for an index patient diagnosed with chlamydia and 3 of their partners using the CDC 2021 STI treatment guidelines. It is best practice to be very specific in the dispensing instructions for EPT and to also write out the words Expedited Partner Therapy in case the receiving pharmacist is not familiar with the practice. The listed quantity should reflect the total number of doses to be dispensed by the pharmacy under the index patient's name. For this example, it would be 56 capsules dispensed into 4 bottles of 14 capsules each. Finally, keep in mind the following when prescribing EPT. Other EPT written prescriptions via commercial plans, cash pay, etc., may be written in the name of the index patient or the individual partner. But California law requires the healthcare provider to write Expedited Partner Therapy or EPT on a prescription if they do not have the patient's sexual partner's names. If more than one prescription is given to the index patient for their partners, separate EPT health education materials must be given for each of the patient's partners. Remember, educational resources in a variety of languages are available on our website. EPT can also be integrated into EHR systems via questionnaires or smart tools. Essential Access Health has developed EPT smart tools for eClinicalWorks. If you are interested in utilizing these tools, please contact us at stdprograms@essentialaccess.org. Next, let's practice applying our knowledge in a case study. A cisgender male came into the clinic requesting STI testing. He reported receptive anal sex with 2 cisgender male partners without condoms and denied any genital symptoms. Routine HIV and STI screenings were performed. The patient received positive results for chlamydia from a rectal swab. HIV, gonorrhea, and syphilis results were negative. First-line treatment for chlamydia is doxycycline 100 milligrams by mouth twice a day for 7 days. The alternative regimen of azithromycin 1 gram by mouth can be considered if there is concern that the patient may not complete the 7-day treatment, or if the patient is or could be pregnant. The patient reports being in contact with both partners but is not sure of their legal names. Both patients have financial barriers to seeking treatment. Based on counseling questions and patient-led decision-making, EPT is determined to be the best partner treatment plan for both partners. Let's practice with a quiz. If this patient is using Medi-Cal as their insurance, what would you write for the following parts of this prescription? Whose name would be on the prescription? The patient's name or the partner's name? What dispensing instructions would you include? Let's take a look at the answers in an example. The correct answer for the first question is that the prescription should be written in the name of the patient. Prescription must be written in the name of the person covered by Medi-Cal or Family PACT in order for it to be covered by these programs. For the second question, there are several key points to include in the dispensing instructions. A best practice is to be specific. In this case, the prescription is for 3 7-day courses of doxycycline to be dispensed in 3 separately labeled bottles to treat an index patient and 2 partners. Make sure to include for Expedited Partner Therapy. Several resources are available to support implementing EPT at your organization. Family PACT has several billing resources on their website, which include the ICD-10 code and description, procedures, laboratory, supplies, and medications as indicated. Our Expedited Partner Therapy frequently asked questions for California pharmacists is designed to enhance pharmacists' knowledge, skills, and comfort in prescribing EPT. We would appreciate sharing this with the pharmacies you work with, as it can be helpful to bridge relationships and ensure that EPT prescriptions are filled. For information specific to the use of EPT in California, please visit the website of the California Department of Public Health STD Control Branch at www.std.ca.gov. There you will find guidelines on best practices for the prevention and early detection of repeat chlamydia and gonococcal infections, and the California EPT guidelines that contain detailed information about the background of EPT, guidance on implementing EPT in your clinic, resources, and examples of EPT partner information materials. Finally, please consider some of our other on-demand courses about EPT and best practices. Our Chlamydia and Gonorrhea EPT online course provides an overview of EPT, counseling messages, and how to register for the EPT distribution program in California. This is available in English and Spanish. Our Improving STI Counseling Using Motivational Interviewing course covers motivational interviewing techniques for counseling patients who've been tested positive for an STI to improve counseling with these patients. Our Learning Exchange contains signature trainings and on-demand offerings with opportunities to learn CEs through our learning portal. Thank you. Please contact STD programs at essentialaccess.org with any questions, or if you would like to schedule a call to discuss prescribing EPT at your health center. This project was funded by the U.S. Centers for Disease Control and Prevention, the County of Los Angeles Department of Public Health Division of HIV and STD Programs, and the State of California Department of Health Services Office of AIDS.